A single molecule, a powerful force, a lifesaver. This is insulin, the key player in human health, without which life would be unimaginable. Born from the pancreas, this hormone acts as a gatekeeper, controlling the flow of glucose into our cells. And when it's absent or ineffective, the result is diabetes, a condition that affects millions worldwide. It's not just essential, it's crucial. Insulin, though tiny, holds a giant place in our lives. But how did we come to know about it? Rewind to the early 20th century. Diabetes was a death sentence until the groundbreaking discovery of insulin. Imagine a world where a diagnosis of diabetes meant certain death. This was the harsh reality for countless individuals before the year 1921. But then, in a humble laboratory at the University of Toronto, a glimmer of hope emerged. Two men, Frederick Banting and Charles Best, embarked on a daring exploration of the pancreas and its mysterious internal secretions. Their relentless pursuit led them to the discovery of a hormone they named insulin. This hormone, they found, was responsible for regulating the body's sugar levels, a function that was impaired in individuals suffering from diabetes. The discovery was nothing short of a medical miracle. For the first time in history, a viable treatment for diabetes was now within reach. This groundbreaking work did not go unnoticed. In 1923, just 2 years after their discovery, Banting and Best were awarded the Nobel Prize in Physiology or Medicine, an honor that underscored the magnitude of their achievement. Banting, humble to his core, shared his prize money with Best, acknowledging the invaluable role his partner played in this medical breakthrough. The discovery of insulin was met with widespread acclaim and celebration. For the medical community, it was a testament to the power of scientific inquiry and the potential for innovation in the face of adversity. For patients with diabetes, it was a beacon of hope, a promise of a future not dictated by their illness. But the journey from discovery to widespread use was far from straightforward. It was a path fraught with challenges and setbacks, marked by rigorous testing, meticulous refinement, and tireless efforts to ensure the safety and efficacy of this newfound treatment. The discovery of insulin opened doors to a new era in diabetes management. But how did we go from discovery to widespread use? As we delve deeper into this remarkable story, we'll uncover the fascinating process that transformed a laboratory finding into a life-saving medication, forever altering the course of medical history. From test tubes to mass production, the journey of insulin synthesis is a testament to human ingenuity. Let's delve deeper into this captivating process. For decades, insulin was extracted from the pancreas of pigs and cattle. However, this method was not only inefficient but also posed the risk of allergic reactions due to the slight differences between animal and human insulin. Enter the era of biotechnology. Scientists, in their relentless pursuit of progress, turn to the relatively new field of genetic engineering. The goal? To produce insulin that is structurally identical to human insulin. The process starts with the introduction of the human insulin gene into a suitable vector, typically a bacterium or yeast. This vector then acts as a mini-factory, using the inserted gene as a blueprint to churn out human insulin. As the bacteria or yeast multiply, so does the production of insulin. This insulin is then isolated, purified, and finally packaged into the life-saving vials we are familiar with. This method of producing insulin, known as recombinant DNA technology, marked a significant leap in diabetes care. It allowed for the mass production of human insulin that is safe, effective, and can be produced on a large scale to meet the ever-growing demand. But here's where it gets even more interesting. Scientists didn't stop at merely replicating human insulin. They went a step further, tweaking the insulin molecule to create insulin analogs. These analogs, while structurally slightly different from natural human insulin, are designed to either act rapidly or provide a steady level of insulin over time. This innovation has given patients and doctors a greater degree of control over blood glucose levels, tailoring treatment to individual needs and lifestyles, thereby bringing us one step closer to mimicking the body's natural insulin response. Synthetic insulin revolutionized diabetes care. But how does it interact with our bodies? Stay tuned as we unravel the intricate ballet of biology that enables this vital hormone to keep our blood sugar levels in check. Inside our bodies, insulin conducts a complex and vital orchestra of bodily functions. Let's imagine for a moment, you're at a symphony. The conductor, insulin, steps onto the stage and raises his baton. The musicians, your body's cells, wait in anticipation. The conductor's first downbeat orchestrates the movement of glucose, the body's main source of energy, from the bloodstream into the cells. This is the first movement of our biological symphony. In this process, insulin acts as a key, opening the doors for glucose to enter the cells. When the blood sugar rises after a meal, the pancreas releases insulin into the bloodstream. Insulin then signals the muscle, fat, and liver cells to absorb the glucose. These cells either use the glucose for energy or store it for future use, effectively lowering the blood sugar levels to a normal range. This is the second movement, a harmonious dance of balance and control. However, what happens when the symphony is disrupted? What if the conductor is ignored? In instances of insulin resistance, the cells in your body start to resist or ignore the signal from insulin. The doors remain closed to glucose, causing it to build up in your blood. This is the discordant third movement, one that can lead to type 2 diabetes if the harmony is not restored. In response, the pancreas produces more insulin to compensate, straining itself in the process. This can result in the pancreas gradually losing its ability to produce insulin, leading to type 1 diabetes. This is the fourth and final movement, a crescendo of complexity that underscores the importance of insulin in our bodies. Insulin's role is pivotal, yet it's not without controversy. Let's delve into the contentious world of insulin pricing. This is the coda of our symphony, a narrative that goes beyond the biological and delves into the socio-economic. A story that reveals the complexity of a substance that, for many, is as vital as the air they breathe. Life-sustaining insulin, a boon for many, yet a financial burden for countless others. Imagine this, a life-saving drug, discovered nearly a century ago, but still out of reach for many due to its prohibitive cost. This is the paradox of insulin, the vital hormone that regulates blood sugar levels in the body. Insulin's cost is a hot-button issue in many parts of the world, particularly in the United States, where the price has tripled in the last 2 decades. This increase has placed a tremendous financial burden on those who depend on insulin, often forcing them to ration their supply, jeopardizing their health and, in extreme cases, even their lives. Why is insulin so expensive? It's a complex issue, entangled in a web of patents, competition, and market exclusivity. The original discoverers of insulin sold the patent for a nominal sum, with the noble intention of making it accessible to all. Yet, today, only 3 companies control the majority of the global insulin market, creating a de facto monopoly. Critics argue that these companies have exploited loopholes in patent laws to extend their exclusivity, preventing cheaper generic versions from entering the market. They point to the lack of transparency in pricing, and call for reforms in a system that appears to prioritize profit over patients. However, the other side of the coin presents a different picture. Pharmaceutical companies argue that the high cost is justified by the investments they make in research and development, improvements in insulin formulations, and the complex process of production. The high price of insulin has ignited a fierce debate about affordable healthcare and the ethics of pricing life-saving drugs. It has sparked protests, lawsuits, and legislative actions, pushing for greater transparency, competition, and affordability. While the pricing controversy rages on, researchers are not resting on their laurels. They continue to explore new treatments, alternative delivery methods, and even potential cures for diabetes. Because at the end of the day, the goal is to ensure that every person living with diabetes has access to the care they need, without breaking the bank. In the quest for better diabetes care, new and promising drugs are emerging on the horizon. As pivotal as insulin has been in the management of diabetes, it is not without its challenges. The delicate balancing act of insulin therapy, the constant monitoring, and the risk of hypoglycemia are all hurdles that patients and doctors grapple with. Emerging research is opening up new avenues. Scientists are developing drugs that not only manage blood sugar levels but also address the underlying issues of insulin resistance and beta cell dysfunction. These new classes of drugs, including SGLT2 inhibitors and GLP-1 receptor agonists, are showing promise in the treatment, and potentially even the prevention of type 2 diabetes. Imagine a future where a diabetes diagnosis doesn't mean a lifetime of injections and constant blood sugar monitoring. A future where the treatment of diabetes goes beyond just managing symptoms to actually addressing the root causes. A future where prevention is not just a possibility, but a reality. The landscape of diabetes care is changing, and these innovative drugs are leading the charge. But as with all medical advancements, there are challenges to overcome, questions to answer, and more research to be done. The future of diabetes care is promising, yet the journey is far from over. We hope you enjoyed that deep dive into the world of insulin, a fascinating, life-saving and truly groundbreaking drug. Do like this video and subscribe to the SciSips channel for more interesting science videos. Till next time, stay healthy and stay science-sipped.